presentation?
Yes, Professor.
Okay, just a moment. The students are connecting now. Okay. Let's begin our lecture, and we'll discuss with you Yersiniosis. And doctors, I want to say that this topic is very interesting, and maybe you know about Yersinia species. You know that Yersinia pestis is the causative agent of plague. You know about it, and we'll discuss with you plague in the second semester, the next semester, yes. But in this semester, we'll discuss with you Yersiniosis and Yersinia enterocolytica and Yersinia pseudotuberculosis are the causative agents of Yersiniosis. And Yersiniosis belongs to GIT infectious diseases. Yes, you know about it. But doctors, I want to say that some patients may have generalized forms of Yersiniosis and the secondary focal forms of Yersiniosis, and these patients may have the clinical another clinical signs. The onset of disease is always from abdominal problems, of course. It may be nausea, vomiting, diarrhea, abdominal pain. Yes, but the patients may have only gastrointestinal form of Yersiniosis, and this patient has only dyspeptic problems. But sometimes Yersiniosis may be as abdominal form, and we know that the patients with Yersiniosis may have inflammation in the lymphatic elements, lymphatic nodes of in abdominal cavity. It may be appendicitis. You know that appendix is a lymphoid organ. You know about it. And in Yersiniosis, the patients may have appendicitis due to inflammation in the appendix. What else? The patients with Yersiniosis may have mesenteritis due to inflammation in the mesenteric lymphoid elements. Yes, mesenteric lymph nodes. And the patients with Yersiniosis may have the local forms. The local form of Yersiniosis and gastrointestinal form of Yersiniosis and abdominal form of Yersiniosis belong to the local forms of Yersiniosis. But some patients may have generalized form of Yersiniosis, and it is usually connected with immunosuppression. And the patient, what does it mean, generalized form of Yersiniosis? No, you know about generalized forms in salmonellosis, you know, yes? And what does it mean? Intoxication syndrome and appearance of bacterial foci in many internal organs. And the patients with Yersinia septicemia or Yersinia sepsis or generalized form Yersiniosis, same, yes? They may have intoxication syndrome, of course, enlarged liver and spleen, and microabscesses in many internal organs. It may be in the brain, it may be in the kidneys, in the lungs, and other organs, internal organs. And doctors, what else? We know about immunopathology process in the patients with Yersiniosis, and the patients with Yersiniosis may have the secondary focal forms. We'll discuss with you all clinical forms of Yersiniosis because it is very important for correct clinical diagnosis. It's necessary to write not only Yersiniosis. You will have clinical cases on your exam, on your zachot, And don't write only Yersiniosis and point, yes? It's necessary to write Yersiniosis, then the clinical form of Yersiniosis. For example, it may be gastrointestinal form, or abdominal form, or generalized form, or the secondary focal form of Yersiniosis. Then you write, for example, if the patient has gastrointestinal form, it's necessary to write about gastroenteritis or gastroenterocolitis or enterocolitis. I want to see that the patients with Yersiniosis usually have enterocolitis. And you know, if the patient has colitis, yes, we can observe pathological mixtures in the stool. Yes, you know about it. And it's necessary to write about the clinical variant. And if the patient has the secondary focal form of Yersiniosis, you write about arthritis or erythema nodosum or Reiter's syndrome. We'll discuss with you. And then you write about severity of disease. It may be mild, moderate, or severe course of disease. You know about it. And doctors, if the patient has complication, but complications may be in the patients with Yersiniosis, you write about this complication. Did you understand? It is very important, and we'll return, of course, to correct clinical diagnosis, and we'll discuss with you the clinical classification of Yersiniosis. It is very important for correct diagnosis, and it is very important for correct treatment. And doctors, Yersiniosis refers to the illness caused by Yersinia enterocolitica and less often by Yersinia pseudotuberculosis infections. Yersinia enterocolitica are the most common species causing human enteric intestinal Yersiniosis. And doctors, the first sentence, Yersiniosis refers to the illness caused by Yersinia enterocolitica and less often by Yersinia pseudotuberculosis infections. I want to explain you. We usually observe Yersinia enterocolitica in the patients with Yersiniosis. But Yersinia pseudotuberculosis may be observed rare. Why? The patients with Yersinia pseudotuberculosis, if Yersinia pseudotuberculosis is the causative agent of Yersiniosis, these patients usually have more severe course of disease. But we know that bacteria species want surviving in our organism. And it is better for these bacteria species, for all bacteria species, if we have mild or moderate course of disease. It may be in Yersiniosis, it may be in acute shigellosis, it doesn't matter, yes? Mild or moderate course of disease. It is very good for surviving of bacteria species in our organism. But if the patient has severe course of disease, this patient usually has severe immune response. It is very bad for bacteria species, yes? And severe immune response may lead to destroying of bacteria species. It is also bad for bacteria species, yes? And now you can understand that why we usually observe Yersinia enterocolitica and rare Yersinia pseudotuberculosis in the patients with Yersiniosis. And for example, we know that in acute shigellosis many years ago, Shigella gregorieva Shiga was the main causative agent of shigellosis. But the patients had severe course of disease, and there was high lethality in this group of patients, yes? And now we know that the main etiology agents of acute shigellosis are Shigella zonnae and Shigella flexneri. Why? Because the patients with this Shigella species usually have mild or moderate course of disease. And the same situation in Yersiniosis. In the United States, Yersiniosis have been estimated to cause almost 170,000 illness, 640 hospitalizations, and up to 35 deaths each year. Children are infected more often than adults, and the infection is more often in the winter. Doctors, we usually say about sporadic cases of Yersiniosis, and we'll discuss with you epidemiology of Yersiniosis, and you can understand why. The patients usually have, we usually observe sporadic cases of Yersiniosis and why in winter. Also, Yersinia pseudotuberculosis and Yersinia enterocolytica were identified as human pathogens early in the 20th century. Their significance as causes of human disease was not appreciated until much more recently. Yersinia pseudotuberculosis and Yersinia enterocolytica appear to be more commonly associated with human disease in Europe, particularly northern parts of the continent, than elsewhere. There are two possible explanations for this apparent regional predominance. The first reason: more widespread appreciation by clinicals and microbiologists in this part of the world. And what's conclusion? Good diagnostic. The next: more frequent exposure to environment sources, particularly pork products. Both organisms can be acquired by either oral ingestion or direct inoculation through blood transfusion. Doctors, I want to explain that we usually say about elementary way of transmission. And elementary way of transmission is the main way of transmission in Yersiniosis. Just a moment. And doctors, sometimes we can say about parenteral way of transmission. In what cases? For example, somebody had subclinical form of generalized Yersiniosis. It may be rare, but maybe. And he is a donor, for example, yes? And we usually give the blood from this donor, yes? And you know that this blood may be stored in the refrigerator during several weeks. It may be 3 weeks, yes? But doctors, we know about specificity of Yersinia species. Yersinia species like low temperatures. You know that other bacteria species like the temperature of our body, the temperature 37 degrees, yes? And the growth of many bacteria species is maybe only in this temperature, in the temperature of our body. But Yersinia species like low temperatures. And they may not only storage in the refrigerator, they may multiply in the refrigerator. And if this blood from donor, yes, this blood stayed in the refrigerator during several weeks, for example, yes, and if Yersinia species were present in this blood, they could multiply. And if recipient receives this blood, this patient receives not only blood, but also a lot of Yersinia species. And in this case, the patient may have generalized form of Yersiniosis at once. without dyspeptic symptoms. Did you understand, doctors? I repeat again that the main way of transmission is an elementary way of transmission, but sometimes, very rare, it may be parental way of transmission, and I hope that you understood. Yersinia enterocolytica, this is a more common cause of intestinal infection in humans. Yersinia pseudotuberculosis is thought to be distinguished less widely in the environment than Yersinia enterocolytica, but both are considered to be significant foodborne pathogens. Yersinia pestis, this is the organism which causes plague. You know about it. And doctors, what else? Yersinia, you know that Yersinia enterocolytica and Yersinia tuberculosis appear to be more commonly associated with human disease in Europe, and you know about this fact, yes? And the next, etiology of Yersinia species. Yersinia species are gram-negative facultative anaerobic coccobacilli in the family Enterobacteriaceae. Yersinia enterocolytica is mobile at temperatures of 20 to 29 degrees, but becomes non-motile at normal human body temperature. Doctors, this fact is very important. I want to say that Yersinia enterocolytica may stay outside in the soil, for example, in water during a long time at low temperatures. And in these conditions, these bacteria species are usually mobile, but they don't produce some virulence factors. We'll discuss with you virulence factors of Yersinia species, and these virulence factors play an important role in pathogenesis and clinical picture of Yersiniosis. And at low temperatures, Yersinia species are motile, but don't produce virulence factors. At the temperature of our body, 37 degrees, they become non-mobile, but they begin producing of many virulence factors. It is very important. Yersinia enterocolytica causes yersiniosis, which is an animal-borne disease occurring in humans as well as in a wide array of animals: cattle, deer, pigs, birds. There is only one biogroup of Yersinia pseudotuberculosis, which includes 6 serological variants, and 6 biogroups of Yersinia enterocolytica. The most important Yersinia enterocolytic serogroups in Europe are serogroups O3 and O9. What does it mean? O. It is somatic antigen of Yersinia species. Somatic antigens or O antigen, same, yes? And biogrouping, serogrouping are connecting are connected with O antigen, and biogrouping are connected with biochemical activity of Yersinia species. Yersinia pseudotuberculosis and Yersinia enterocolytica are subtyped based upon biochemical reactivity, biogroups, and by surface antigenic determinants serogrouping, particularly the cell surface or somatic O antigen. Subtyping is important epidemiologically since the serotype distribution varies between Europe, North America, and Asia. And doctors, What else? Now you know about serogrouping and biogrouping of Yersinia species. And I want to say about several groups of Yersinia species. And the first group, just a moment, doctors, the students are connecting. And the first group is high pathogenic kinds. High pathogenic kinds. These Yersinia species consist high pathogenic islands, and they belong to these high pathogenic kinds. Yersinia pestis, the next, Yersinia enterocolytica biovar 1b, Yersinia enterocolytica biovar 1b, Yersinia pseudotuberculosis sera group 1. The next group, moderate pathogenic kinds. They have no high pathogenic islands. And Yersinia pseudotuberculosis serogroups 2, 4, and 5, and Yersinia enterocolytica biovars 2, 3, 4, and 5 belong to this second group with moderate pathogenic kinds. And doctors, the last group of Yersinia species, non-pathogenic kinds and variants. Yersinia enterocolytica biovar 1a, Yersinia intermedia, Yersinia frideriksoni, Yersinia aldova, Yersinia rhodii, Yersinia mollaretti, and Yersinia ruckel. High pathogenic kinds of Yersinia species with high pathogenic islands in their structure, yes. The next, moderate pathogenic kinds without high pathogenic islands. And the last group is non-pathogenic kinds and variants. Okay. And doctors, you know about several serogrouping, yes, and several serogroups and biogroups, and Yersinia enterocolytica, you know about 5 groups and several serogroups, and Yersinia pseudotuberculosis, only 1 biogroup and 6 biogroups Okay. Now, you can see this slide, hyperpathogenic kinds, Yersinia pestis, Yersinia enterocolytica biovar 1b, Yersinia pseudotuberculosis serogroup 1, moderate pathogenic kinds, HPI negative, yes, and non-pathogenic kinds and variants. Doctors, hypathogenic islands is the iron acquisition determinant, which is absolutely necessary for expression of the trait of virulence. Okay. And doctors, the next. This information is very important for us. We'll discuss with you virulence factors of Yersinia species. Pathogenic Yersinia enterocolytica produce a variety of proteins which facilitate adherence of the organism to the gut mucosa, binding to intestinal epithelial cells, and invasion the gut wall. The organism elaborates additional proteins which enable it to evade host defense mechanisms, including phagocytosis and resistant to bactericidal action of serum. Doctors, we'll discuss with you the action of some virulence factors, and you can understand that many of these virulence factors may block phagocytosis. But you know that phagocytosis plays an important role in immune response. And we know about non-specific immunity, yes, and phagocytosis belongs to non-specific immunity, yeah? And if phagocytosis is blocked, yes, it usually leads to immunosuppression. And it always elicits dissemination of bacteria species via dissemination of many bacteria species in the macroorganism. You know about it, and it may be in many infectious diseases, not only in Yersiniosis, yes, and phagocytosis complement system, yes, and complement phagocytosis may be known without complement system. Complement system also plays an important role in phagocytosis, but some virulence factors of Yersinia species may block complement system, yes, and it leads to decreasing of to blocking of phagocytosis. Expression of many of these virulence factors is temperature dependent, and we discussed with you that at low temperatures, Yersinia species are usually motile, but they not produce virulence factors. But in our organism, at the temperature of our body, they begin producing of some virulence factors. And at the temperature 25 degrees, the organism is motile and doesn't express some virulence factors. Yes? Okay, and now let's discuss with you these virulence factors. Doctors, if our conference is stopped, yes, you can have 10 minutes for your rest, and after 10 minutes, let's connect again, okay? And doctors, the first virulence factor is invasion. Invasion plays an important role, yes, and its role is adhesion, penetration into cells of the owner, introduction of an inflammation in lymphoid tissue. Doctors, we know that the pathology maybe not only in the on the mucus of intestinal mucus membrane, yes, but in Yersiniosis it may be in the lymph elements, Baer's patches, and mesenteric lymph nodes, yes, and invasion plays an important role in this process, yes, introduction of an inflammation in lymphoid tissue. Adhesion, the next virulence factor, yes, its function, adhesion and colonization, antiphagocytic activity, introduction of an inflammation. You can notice adhesion and colonization and antiphagocytic activity. The next virulence factors of Yersinia species, proteins of an outside membranes, Yersinia outer proteins, and their function. Doctors, Yersinia outer proteins. There are several proteins. It may be Yersinia outer protein E, Yersinia outer protein H, B, D, N, and Q. And their function, antiphagocytic activity, cytotoxicity, immunosuppression, and dissemination in tissues of an organism. They elicit dissemination in tissues of an organism. And we know about the reason, yes? Antiphagocytic activity, immunosuppression, yes? And it elicits the dissemination in tissues, the dissemination of Yersinia species in tissues of an organism. Don't forget about Yersinia autoproteins and about their function. The next, LPS. You know that many bacteria species consist LPS, and you know about its function, complementary activity, and you know about increasing of interleukin synthesis, yes, and LPS plays an important role in this process. And what else? Intoxication syndrome is always connected with LPS. And the same role of LPS in Yersiniosis. The next, doctors, urease. Urease is absent in this table, yes, but I will explain you. Urease, it is also a virulence factor of Yersinia species, and its function, neutralization of an acid in a stomach. You know that if the patient has low level of acid in stomach, yes, maybe hyperacidic gastritis, yes, it usually elicits, it is very good for many bacteria species, for Vibrio cholera, for Yersinia species, and other GID bacteria species, yes. And urease plays, urease of Yersinia species plays an important role, and what kind of role? Neutralization of an acid in a stomach. And the next virulence factor, which is also absent in this table, catalase, and its function is also antiphagocytic activity. And doctors, what else? Enterotoxin. No, doctors, you know, I hope that you know about its function. Enterotoxin, its function is stimulation of GMP in enterocytes. GMP accumulation. Doctors, we know about dyspeptic symptoms in the patients with Yersiniosis. We know about diarrhea, we know about abdominal pain, and it is connected with the action of enterotoxin. What else? V and W antigens are absolute pathogenic factors of Yersinia species. And what else? The next virulence factor of Yersinia species is Yersinia bacteria. But doctors, only BioVar 1b. BioVar 1b consists this Yersinia bacteria. And its function is carry of iron into microbe cells. Yersinia enterocolytica is also an iron-loving organism. It contains several pathways to facilitate iron uptake, which is essential for growth. Invasion is an important virulence factor for early stages of infection and is regulated by the phase of growth of the organism and temperature. Yersinia autoproteins are plasmid mediated. And doctors, Yersinia autoproteins are injected by the organism into cells which are believed to result in destroying, yes, of the cellular immune mechanism. Yersinia outer protein P, one of these plasmid encoded proteins. And doctors, I want to say several words about, just a moment. And doctors, you can see that Yersinia species like iron and, for example, biovar 1b may use this iron for the growth, yes? And if the patient has some problems with his blood, it may be a high level of iron in blood, yes? This patient may have, if this patient has yersiniosis, this patient may have generalized form of yersiniosis. A lot of iron, yes, and this iron may be used for Yersinia growth, yes, and the patient may have severe generalized cause of disease. Now you know about the virulence factors of Yersinia species, and you could understand that Yersinia species may lead to blocking of phagocytosis, and it usually leads to immunosuppression, and it elicits dissemination of Yersinia species in the organism. You know about it, and you know that many of Yersinia virulence factors are plasmid mediated, yes? Okay. And the next. And doctors, now about several words about epidemiology. The reservoir for many Yersinia species may be a wide range of wild and domestic animals. The pig is the main reservoir for Yersinia enterocolytica. Yersinia pseudotuberculosis has been isolated from deer, goats, sheep, cattle, and rodents. Transmission. Fecal-oral transmission occurs by consumption of contaminated food, pork products, unpasteurized milk, or water. By direct or indirect contact with infected animals, including pets. Transfusion of stored blood from donors who were asymptomatic or who had mild illness, yes, and by direct person-to-person transmission, but doctors, it may be rare. It may be rare. For example, if somebody has a child and this child has yersiniosis, yes, and every day his mother has a deep contact with this child, yes, in this condition, transmission may be, but it may be rare. Doctors, the ability of Yersinia enterocolytica grow at 4 degrees means that refrigerated meat and meat products can become a potent source of infection. Yersinia enterocolytica sepsis has been reported following transfusion of blood stored more than 3 weeks at 4 degrees. You know about it, yes, it is very important. Okay, and doctors, what else? We know that Yersinia species may stay outside, in water, in the soil, at low temperatures during a long time. And The next reservoir for Yersinia species may be animals, and usually usually rodents. Yes, it may be mice or rats. And I want to say that in their organism, Yersiniosis may be asymptomatic without symptoms, and they may be as carrier of Yersinia species. But there are, if the rat or mice have Yersinia species in their organism, yes, there are a lot of Yersinia species in their urine. And this urine may be on vegetables, for example, yes. And we know that I said you about sporadic cases of Yersiniosis in winter, for example. Why in winter? Doctors, we know that we usually storage, no, in Russia, yes, we usually storage vegetables in winter, in spring, and in winter. We usually storage vegetables in specific buildings with low temperatures. And these vegetables may stay in these buildings during several months, yes, during all of winter and spring. But unfortunately, not only vegetables are present in this building, specific building, but there are a lot of rodents maybe in these buildings. And if they have Yersiniosis, the urine may be on vegetables, carrot, cabbage, yes. And in spring, we usually think, oh, it's necessary to eat a lot of vegetable salads. Why? Due to vitamins, yes? There are a lot of vitamins in these vegetables, and I want to eat every day vegetable salads. But unfortunately, we don't forget about Yersinia species. Yersinia species may be present in this salad, yes? And if you make this salad, yes, please remove 4 lists, 4 superficial lists from cabbage, yes, and clean this cabbage under hot water, and please clean the carrot also for this salad, yes. And we know about several cases, clinical cases, which were connected with Yersiniosis. And this patient said about vegetable salads in spring, yes. And I want to say about one doctor. She was young. She was a young doctor, yes, and she was a surgeon. And she was operated in the surgical department, and she had appendicitis. And she was operated. But after operation, she had again subfebrile temperature and diarrhea. And one surgeon asked me to examine this patient. And before examination, I asked her about epidemiological anamnesis. And she said it was in spring, it was March, and this patient said that she consumed vegetable salads from cabbage and carrot every day. And she had, before operation, she had diarrhea, subfebrile temperature, and then abdominal pain appeared in the right part of her abdomen. And she had some appendicitis symptoms, and she was operated. But after operation, her condition stayed same. Yes, she had diarrhea, she had subfebrile temperature, and I I knew about her epidemiological analysis, and I asked her to show me her extremities, the distal parts of her extremities. But we know that in yersiniosis, the patients with yersiniosis, from the second week after the onset of the disease, they may have desquamation, skin desquamation on the distal parts of their extremities. And she had this desquamation. Then I asked her to show me her tongue, and she had a specific tongue. We'll discuss with you the clinical signs of yersiniosis. And doctors, I understood that it was yersiniosis, abdominal form of yersiniosis, appendicitis, but her appendix, at the moment of histology investigation, her appendix had cateral inflammation, only cateral inflammation, and we investigated her blood. We used serological test, and this patient had high titers of antibodies to Yersinia antigen. It was yersiniosis. The local form of yersiniosis, appendicitis, moderate course, and she was operated. And doctors, don't forget about it, that some patients with yersiniosis may be hospitalized into the surgical department because it is connected with the abdominal form of yersiniosis. And doctors, the rodents are the main reservoirs for Yersinia species. What else? Yersinia species may be present in some milk products. It may be sour cream, it may be ice cream, and ice cream, it is the best for Yersinia species, milk product, and low temperature. Yes, and low temperature. And I want to say that in the 20, we know about one outbreak of yersiniosis, and the positive agents of that yersiniosis was Yersinia pseudotuberculosis, and we know that approximately 300 patients had pseudotuberculosis, and this pseudotuberculosis was connected with ice cream. All these patients consumed ice cream, and they had yersiniosis, and some patients had severe cause of yersiniosis, pseudotuberculosis, yes? And you know that we usually storage all milk products in the refrigerator, but we know that low temperatures are very good for Yersinia species, and they may not only stay in the milk products, but they may also multiply in the refrigerator at low temperatures, milk products. And the next, the meat may be the reservoir for Yersinia species, and we know that pig's meat may consist of this Yersinia species, and we know that Yersinia enterocolitica 09 may be present in the pig's meat, yes, and it may be the reservoir for Yersinia species, some meat products. And doctors, vegetables, yes, vegetables, milk products, and some meat products, usually pig's meat. Okay. Sources of Yersinia infection, yes, human, pig's meat, vegetables, human, person-to-person transmission may be rare, and nowheres, pets, wild animals may be the reservoir for Yersinia species. Okay. And several words about pathogenesis. The first, if you remember about urease, yes, about urease, neutralization of stomach acid, yes, and the next Yersinia infections begin with ingestion of bacteria in contaminated food or water. After oral ingestion, the organism invades the intestinal epithelium using an array of virulence factors. And the next invasion of epithelium, translocation to M cells in lymphoid tissues, yes, the patient may have only, and doctors, after oral ingestion, the organism invades the intestinal epithelium using an array of virulence factors. What kind of virulence factors? Enterotoxin, yes, and the patient, and LPS, yes, and other virulence factors. You know about these virulence factors, and the patient may have the clinical signs of GIT, infectious disease, intoxication syndrome, fever, yes, chills, headache, maybe, and common weakness, and dyspeptic symptoms. It may be nausea, vomiting, but I want to say that nausea and vomiting, these symptoms are rare in Yersiniosis. And the patients may have, usually have abdominal pain, and in the right abdominal region, yes, and the patients have diarrhea. It may be 5 or 10 times daily. And what else? Pathological admixtures in feces. It may be mucus and blood in their feces, yes. And you know that the patients with Yersiniosis usually have enterocolitis. If colitis is present, we know about the presence of pathological admixtures in feces, yes? And all clinical symptoms may be stopped. And in this case, we usually think about food poisoning disease. The patient has intoxication syndrome, dyspeptic symptoms, and if all symptoms are stopped on this stage, yes, we think about food poisoning disease. The patient may be hospitalized into infectious hospital, and he receives rehydration treatment, enterosorbents, maybe without antibiotics, and after clinical recovery, this patient may be discharged from the hospital. But some patients may have the next stage of pathogenesis. Yersinia species, and the next step, it then localizes to lymphoid tissue on the intestinal mucosa and is carried regional lymph nodes with the mesentery. You know about Peyer's patches. You know about lymphoid elements, yes, intestinal lymphoid elements, and you know about appendix. Appendix also belongs to lymphoid organs, yes, and in this case we can notice inflammation in these lymph elements. Inflammation in the appendix leads to appendicitis. Inflammation in mesenteric lymph nodes leads to mesothelitis. And inflammation in the lymph elements of ileum usually leads to ileitis. And I want to say that these patients usually have intoxication syndrome and the clinical form of abdominal abdominal clinical form of yersiniosis. Yes, it may be appendicitis, it may be mesothelitis, it may be ileitis. And doctors, in the all clinical signs may be stopped on this stage, and after clinical recovery, the patient may be discharged from the hospital, but we know that this patient had appendicitis. Some patients may be operated if they have appendicitis symptoms, yes. Some patients may have mesothelitis, and I want to say that the duration of disease, if the patient has mesothelitis, Yersinia mesothelitis, the duration of disease is usually long, and the patients usually have long-term abdominal pain. Yes, and in this case, ultrasound examination of abdominal cavity may help us in confirming of diagnosis. Yes, and doctors, I want to say that if the patient, due to blocking of phagocytosis, the patients may have incomplete phagocytosis, yes, and it elicits of Yersinia dissemination into other regional, into other lymphoid elements, yes, and some patients may have abscesses in this lymphoid tissue, yes, and we know about granuloma formation in the patients with yersiniosis. But doctors, the patient may have abdominal form of disease, and it is connected with inflammation in lymphoid tissues of abdominal cavity, yes. But the patient, after this, the patient may have a recover. But some patients, and it is usually connected with immunosuppression, of course, yes, the patient may have generalized form of infection, yes, and Yersinia septicemia can occur during acute infection, particularly among infants and those with impaired immunity or iron overload states, yes. And in this case, we can notice generalized form of yersiniosis. When Yersinia species are present in the bloodstream, yes, and we can observe a lot of Yersinia foci in different internal organs. And in this case, bacteremia and toxinemia usually increase, yes. And what else? And yersiniosis may be stopped on this step of pathogenesis. The patient had generalized form of yersiniosis, yes, and all clinical and at the moment of clinical recovery, all these symptoms may be stopped. But some patients, doctors, may have the secondary focal form of yersiniosis due to immunopathology process, autoimmune reactions, and slow type of hypersensitivity. And it may be if Yersinia antigens look like tissue antigens of our organism, yes? And if B27 antigen is present in the microorganism, yes, this patient may have immunopathology process, this patient may have the secondary focal form of Yersiniosis. And it is connected with immunopathology reactions, yes, and sensibilization process, yes, and it is connected. It is maybe why when Yersinia antigens look like tissue antigens of our organism, yes, and long-term presence of Yersinia species in the organism usually leads to relapses form and chronic cause of Yersiniosis. Doctors, I want to repeat for you. The first step of Yersiniosis, injection, after oral injection, the organism invades the intestinal epithelium using an array of virulence factors, and the patient on this stage of pathogenesis, the patient may have the clinical signs of GID infectious disease, yes, it may be a intoxication syndrome, yes, and dyspeptic symptoms, abdominal pain, diarrhea, the clinical signs of pathological leeches in feces, and all these symptoms may be stopped on this step. Actually, and the patient may have clinical recovery. And doctors, often the patient doesn't know about Yersiniosis. He doesn't know about this diagnosis, this clinical diagnosis. And the doctors don't know about Yersiniosis. Why? Doctors, you know that for diagnostic, for lab test, we usually use specific culture medias to confirm Yersiniosis. It's necessary to use specific temperature conditions. But if the patient has the clinical signs of food poisoning disease, we usually use the culture medias for Salmonella species, for Shigella species, and the result of this bacteriological anamnesis may be Salmonella species negative, are negative, and Shigella species are negative, and the patient has diagnosis food poisoning disease. And now you know why. Because for Yersinia species, it's necessary to use specific culture medias and temperature conditions. Yes, and the patient may have recovery, clinical recovery, and this patient may forget about this disease. Yes. What else? Some patients may have the next step of pathogenesis, and it is connected with inflammation in the lymph elements of abdominal cavity. Yes, appendix, Peyer's pictures, lymph elements, intestinal lymph elements, and inflammation in mesenteric lymph nodes. Yes, and in this case, the patient may have the clinical signs of appendicitis, mesodynitis, and ileitis. Yes, and all these symptoms may be also stopped, and we can say about abdominal form of Yersiniosis, and we write about this abdominal form, for example, appendicitis, Yersiniosis, abdominal form, appendicitis, moderate cause, yes? But some patients, and it is connected with immunosuppression, yes, usually it may be connected with immunosuppression. Some patients may have generalized form of Yersiniosis when Yersinia species are present in the bloodstream. And these patients usually have high intoxication syndrome, high toxemia, Yes, and these patients usually have bacterial foci in many internal organs, and all these symptoms may be stopped. And the patient, after generalized form of yersiniosis, the patient may have clinical recovery. But some patients may have immunopathology process, autoimmune reactions, and slow type of hypersensitivity. And due to this process, the patients may have the secondary focal forms of yersiniosis. And it may be arthritis, it may be erythema nodosum, it may be thyroiditis. Autoimmune process may be in many internal organs. Don't forget about it. And doctors, what else? It is very important. I want to say that the patient with yersiniosis may have, for example, the first step of pathogenesis. For example, the clinical gastrointestinal form of yersiniosis. This patient has no abdominal form of yersiniosis. This patient has no generalized form of yersiniosis. But after 3 weeks after the onset of his disease, not food poisoning disease, the patient usually thinks about food poisoning disease. The patient has arthritis. I want to say that the patient may have only 1 or 2 forms of yersiniosis. Don't think that the patient should have all clinical forms of yersiniosis. Gastrointestinal form, abdominal form, generalized form, secondary form, the secondary focal form of yersiniosis. It is not correct. Maybe a gastrointestinal form of yersiniosis, abdominal form of yersiniosis, and stop. The patient may have gastrointestinal form of yersiniosis and the secondary form of yersiniosis, without abdominal form of yersiniosis and generalized form of yersiniosis. Did you understand, doctors? Doctors, can you hear me?
Yes.
Okay. All steps of pathogenesis may be present, but in some patients it may be the first step of pathogenesis and the last step of pathogenesis. It may be. Okay. And doctors, we know about granuloma formation in yersiniosis, yes, and several words about morphology. We can observe cateral inflammation in the patient's intestine. Yes, we can observe ulcers. Yes, and these ulcers are usually present near to enlarged Peyer's patches and lymphoid elements. These ulcers are usually present near to Peyer's patches and lymphoid elements. And we know that lymph nodes, intestinal mesenteric lymph nodes, may be enlarged in volume, yes, and they may be sometimes they may be combined, yes, and they may be very large, yes, and appendix usually has cateral inflammation, but sometimes, very rare, it may be gangrene of appendix, but it may be very rare. In generalized forms of yersiniosis, we can observe enlarged liver and spleen, and we can observe the foci, bacterial foci in the lungs, in the kidneys, in the pancreas, in the brain, and we can observe micro abscesses in these organs. Yes. At the moment of histology, we can observe granulomas, and granulomas usually have necrosis, yes, and reticular cells and polynuclear leukocytes. And we can often notice rash on the skin in the patients with yersiniosis, and it is connected with endoperivasculitis, and allergic component plays an important role in this process. And if the patient has erythema nodosum, the secondary focal form of yersiniosis, yes, it is connected with arteritis in the subcutaneous fat, and we can observe inflammation in the subcutaneous fat. But specific elements in the patients with erythema nodosum, they are usually dense, painful, red-colored with cyanosis, and if you press on these elements, the patient usually says, "Oh, it's very painful." Why? It is connected. The appearance of these elements are always connected with inflammation process in the vessels of subcutaneous fat, arteritis, and it is connected with inflammation in the subcutaneous fat. And doctors, now we know about pathogenesis of yersiniosis, yes, and now let's discuss with you clinical picture of yersiniosis. Clinical forms of Yersinia infection. Doctors, it's very important for us because when we ask you to write complete clinical diagnosis, yes, don't write only yersiniosis, you know about it. It's necessary to write about the clinical form of yersiniosis. And the first clinical form of yersiniosis, it is a gastrointestinal form of yersiniosis. Doctors, gastrointestinal form of yersiniosis belongs to the local form of yersiniosis. Yersinia species are absent in blood, in the bloodstream. Gastrointestinal form.
Excuse me. Should we rejoin immediately, right? Because the meeting will finish soon.
Gastrointestinal form, your sound is bad, doctor.
I mean, about meeting will finish soon. Should we rejoin?
Okay. Okay. Just a moment. I can't see. Okay. Doctors, can you see my presentation?
Yes.
Okay. And doctors, the first clinical form of yersiniosis is gastrointestinal form of yersiniosis. But doctors, this form of yersiniosis belongs to the local forms of yersiniosis. And we know about several clinical variants of this gastrointestinal form. And you can write gastroenteritis, enterocolitis, and gastroenterocolitis. Gastrointestinal form appears with gastroenteritis, gastroenteritis, enterocolitis and gastroenterocolitis. And doctors, I want to repeat that the patients with Yersiniosis usually have enterocolitis, but maybe gastroenteritis may be but rare. Usually enterocolitis. And abdominal form of disease appear with acute ileitis, mesodynitis, or appendicitis. No? You know about it, yes? And generalized form appears with hepatitis, meningitis, pyelonephritis, pneumonia, like scarlet fever form, septic variant. And secondary focal form appears with arthritis, erythema nodosum, Reiter syndrome, thyroiditis, Crohn-like disease, myocarditis, and these clinical forms are connected with immunopathology process, and you know about it. Doctors, gastrointestinal form and abdominal form of Yersiniosis belong to the local forms of Yersiniosis. Yersinia species are absent in blood. Generalized form, you know, Yersinia species are present in blood, in the bloodstream, yes, and the secondary focal forms are connected with the immunopathology process. And let's discuss with you the first clinical form of Yersiniosis, gastrointestinal form of Yersiniosis. Incubation period may be from 1 to 2 days up to 11 days. Acute gastroenteritis from Yersinia is marked by diarrhea, loose stools with mucus, sometimes blood, from 2 to 15 times a day, abdominal pain, fever, and less frequently nausea and vomiting. When abdominal pain occurs, it is often noted to be in the right lower quadrant. It is a helpful diagnostic tool. Doctors, I want to say that specificity abdominal pain in Yersiniosis, specific abdominal pain. Doctors, we know that if the patient has salmonellosis or food poisoning disease, yes, localization of abdominal pain is epigastrium, yes, and paraumbilical region, spasmodic abdominal pain. In the patients with Yersiniosis, this abdominal pain is usually localized in the right lower quadrant. It is very important for diagnosis. What else? Since no other cause of acute bacterial diarrhea routinely produces pharyngitis, this symptom can be helpful in suspecting the diagnosis. Doctors, pharyngitis. The patients with Yersiniosis may have pharyngitis, but you know that pharyngitis is absent in the patients with food poisoning diseases, with shigellosis, with salmonellosis, yes, but the presence of intestinal symptoms and pharyngitis may be very important for diagnosis, Yersiniosis, yes? And we know that it is localization of abdominal pain, yes, and the presence of pharyngitis and GIT problems may say about Yersiniosis. At the beginning of the disease may appear dotted of small patchy rash on the trunk and limbs. Doctors, you know that the appearance of fresh elements may be usually in the patients with generalized forms of infectious diseases, appearance of rash elements on the skin. But I want to say that in Yersiniosis, rash elements may appear in the local forms of Yersiniosis, and it is connected with allergic process. If you remember about the slow type of hypersensitivity, yes, you can understand that the patients with the local form, approximately 50% of patients with the local form of Yersiniosis may have rash elements. And these rash elements are usually maybe around the joints on the skin and on other sides of the body. Rash elements, you know that the rash elements are absent in the patients with food poisoning diseases, in the patients with acute tuberculosis, in the patients with salmonellosis. Rash in salmonellosis rash elements may be present only in the generalized forms of salmonellosis. In the local forms, rash elements are absent. But in Yersiniosis, these rash elements may be present in the local forms. It is also very important. What else, doctors? The patients with the local form of Yersiniosis may have reactive arthritis. Reactive arthritis may follow enterocolitis in up to 10% of cases. It is especially frequent in those with the HLA-P27 phenotype. But doctors, reactive arthritis, it may be the secondary focal form of Yersiniosis. But the patients with the secondary focal form of Yersiniosis, but the patients with the gastrointestinal form of Yersiniosis may have arthalgia. And it is also very important for diagnosis because you know that arthalgia is absent in the patients with food poisoning diseases, salmonellosis, shigellosis, and the presence of GIT problems and localization of their abdominal pain in the right low part, in the right low part of abdomen, the presence of pharyngitis, the presence of arthalgia may help us in confirming or diagnosis Yersiniosis. And what else? The median duration of diarrhea is longer than the illness caused by most other bacterial diarrhea agents. Long-term diarrhea in Yersiniosis more longer than in other GIT infectious diseases. It is also very important. And what else? Another characteristic of acute Yersiniosis is prolonged, even after symptoms have subsided, prolonged fecal shedding of the organism, even after symptoms have subsided. 47% of patients were found to shed the organism a median of 40 days. This feature of yersiniosis has implications for possible person-to-person transmission and for the child care or healthcare settings should be excluded or should use special precautions. And doctors, now you know about the first local form of yersiniosis, gastrointestinal form of yersiniosis. You know about some specific clinical symptoms of yersiniosis, gastrointestinal form of yersiniosis. And now I want to show you specific some in the patients with yersiniosis. All patients with yersiniosis and the clinical form of yersiniosis doesn't matter, may have specific tongue. You can see strawberry-like tongue. You can see specific tongue, strawberry-like tongue. Yes. What else? The patients with yersiniosis, you know, and the clinical form of yersiniosis doesn't matter, may have from the second week after the onset of disease, they may have desquamation of their skin. Desquamation, it may be after 1 week after the onset of disease. And this desquamation may be on the distal parts of extremities. And this symptom is also very important because skin desquamation is absent in the patients with salmonellosis, food poisoning diseases, or acute shigellosis. Yes. Specific tongue, yes, specific tongue, skin desquamation, and skin desquamation may be in the patients with gastrointestinal form of yersiniosis, abdominal form of yersiniosis, generalized form of yersiniosis, and this symptom is also very important for correct clinical diagnosis. And doctors, now you know about gastrointestinal form of yersiniosis. Yes, and I want to say that unfortunately, often this clinical form of yersiniosis may be undiagnosed because the clinical signs of dyspeptic syndrome are usually prevalent. Yes. But now you know about specific clinical signs of yersiniosis. Yes, localization of abdominal pain, pharyngitis, specific arthralgia, specific tongue, strawberry-like tongue. Yes. What else? Desquamation of the skin from the second week after the onset of disease. Yes, and all these signs are very important for confirming of diagnosis, the local form of yersiniosis. And doctors, what else? The patients with yersiniosis, usually if Yersinia pseudotuberculosis is the causative agent of disease, the patients with yersiniosis may have some specific symptoms. Hood symptom, what does it mean, hood symptom? Hyperemia of their face and neck, and edema of their face. Yes, hood symptom. What else? Gloves symptom and sock symptom. Hyperemia of the distal parts of their extremities and edema of these parts of extremities. Sock symptom and glove symptom. And doctors, it is also it is also connected, these symptoms are also connected with allergic process in yersiniosis. You know about this slow type of hypersensitivity, and allergic process is present in the onset of disease. After several days after the onset of disease, we know about it, and this allergic process is present in the patients with the local forms of yersiniosis and generalized, and of course in the secondary focal forms of yersiniosis. Doctors, now you have your rest 10 minutes, and after 10 minutes, connect again. We will continue our discussing, and we'll discuss with you the next local form of yersiniosis, abdominal form of yersiniosis. Okay, doctors,
Okay.
you have your rest 10 minutes. 10
All right.
minutes.
Okay.
Okay, doctors. Next clinical form of yersiniosis is abdominal form of yersiniosis. In some patients with acute Yersinia infection, abdominal symptoms and systemic toxicity, right lower abdominal pain, high fever, vomiting, and leukocytosis are far more prominent than diarrhea, which can be minimal. This type of presentation can be confused with acute appendicitis. Such patients often undergo abdominal surgery for suspected appendicitis or other abdominal emergencies. At surgery and on histopathology, findings include inflammation around the appendix, terminal ileitis, and inflammation of the mesenteric lymph nodes, either alone or in combination. Appendix shows only minimal inflammation. Doctors, the students usually ask, in what cases, if the patient has abdominal form of yersiniosis, appendicitis, in what cases this patient should be operated? I can answer, if the patient has yersiniosis, appendicitis, and we begin our treatment, antibiotics of course, and if after several hours his condition is not better, yes, appendicitis symptoms state, yes, this patient should be operated. And in some cases, if when we begin our antibiotic treatment and the patient's condition becomes better, appendicitis symptoms disappear, yes, this patient may be without operation. But usually these patients have appendicitis symptoms, and these patients are operated. But doctors, in ultrasound examination of abdominal cavity may help us in confirming of diagnosis, and the patients with mesoadenitis may have the clinical signs of appendicitis, severe abdominal pain, and doctors, in this case, ultrasound examination of abdominal cavity helps us, and the doctor may say that the patient has enlarged abdominal lymph nodes, mesenteric lymph nodes, yes. And in this case, we usually use antibiotic treatment during a long time. It may be during 2 or 4 weeks. antibiotic treatment, and we can help this patient. And I want to say that in abdominal forms of yersiniosis, diarrhea, for example, some dyspeptic signs are usually absent. Yes, are usually absent or maybe minimal. But intoxication syndrome, right lower abdominal pain, and leukocytosis and vomiting usually prevalence in these patients. And abdominal form of yersiniosis also belongs to the local forms of yersiniosis. And we know about severity in the local forms of yersiniosis, gastrointestinal, abdominal form of yersiniosis. The patients may have mild, moderate, or severe course of disease, and the patients may have an acute disease, acute course of disease, not longer than 1 month. Yes, not longer than 1 month. 1 month, and if the patient has chronic course, it may be more than 3 months. If the patient has the clinical signs of yersiniosis more than 3 months, yes, it may be the chronic cause of disease. And what else? Recurrent cause of disease, it may be from 1 month to 3 months. Yes, to 3 months. And what else? Doctors. And mild, moderate, and severe course of disease may be in all clinical forms of yersiniosis. Yes, and acute, recurrent, and chronic cause of disease may be in all clinical forms of yersiniosis. And doctors, the next form of yersiniosis is generalized form of yersiniosis, Yersinia bacteremia. The patients usually complain of fever and chills for days to weeks. In some patients, the syndrome of Yersinia bacteremia, just a moment, follows classic enterocolitis. Symptoms are non-specific: malaise, anorexia, and weight loss. The most common manifestations of disease are chills, headache, dizziness, muscle pain, inflammation of the upper respiratory tract, infection, sore throat, dry cough. The most common skin rashes appear on the 2-3 days from the beginning of disease. The elements may be grouped around the joints, but may be on another sides of the body. On the 12th or 15th day of illness, usually begins peeling the skin on the fingers and toes. You know that this situation, this skin discoloration, may be not only in generalized form of disease, but also in the local forms of disease. Arthralgia usually develop on the 3rd or 4th day. Pains occur in several joints at once. The majority of patients have hepatomegaly. Enlarged spleen, rare. And doctors, if the patient with yersiniosis, if you know that the patient has enterocolitis, and after enterocolitis, intoxication syndrome increased, dyspeptic symptoms disappeared, yes, and the patient had high intoxication syndrome, absence of dyspeptic symptoms, rash on the skin, and hepatomegaly, appearance of hepatomegaly in the patients with yersiniosis usually says, and in a combination of increasing of intoxication syndrome and hepatomegaly, usually these symptoms usually say about generalized form of yersiniosis. Splenomegaly may be rare, yes, but hepatomegaly are present in all patients with generalized form of yersiniosis. And doctors, septic form usually develops in patients with chronic disease, sugar diabetes, liver cirrhosis, tuberculosis, blood diseases, immunodeficiency. And doctors, what else? On your zachет, on your exam, you will have the clinical case, the patient with generalized form of yersiniosis, and we know that scarlet fever-like form of yersiniosis belongs to generalized form of yersiniosis. I repeat, scarlet fever-like form. You know that scarlet fever, the positive agent of scarlet fever are usually streptococcus, yes, streptococci. And you know that the children usually have scarlet fever. They have intoxication syndrome, they have tonsillitis, they have rash on the skin, and the patients with yersiniosis may have the symptoms which look like scarlet fever, but they have differences. The patients with yersiniosis may have catarrhal angina, red rash on the skin, strawberry-like tongue, desquamation of the skin, of the distal parts of extremities, intoxication syndrome. These symptoms are same in the patients with scarlet fever-like form of yersiniosis and scarlet fever. Intoxication syndrome, catarrhal angina, red rash elements on the skin, strawberry-like tongue, and desquamation of the skin, yes, of the distal parts of extremities, the same symptoms. But doctors, the patients with scarlet fever usually have necrotic tonsillitis, but the patients with yersiniosis usually have pharyngitis or maybe catarrhal tonsillitis. In scarlet fever, necrotic tonsillitis. The first difference. The next, the patients with yersiniosis have GIT problems, diarrhea, abdominal pain, ileitis, maybe appendicitis, but the patients with scarlet fever have no abdominal problems, without diarrhea, without abdominal pain, and due to some symptoms which look like scarlet fever, yes, we call some generalized forms of yersiniosis scarlet fever-like form of yersiniosis. You know about clinical symptoms of this generalized form, and you know about differences between scarlet fever and scarlet fever-like form of yersiniosis. And the first, of course, in absence of diarrhea, abdominal pain, ileitis, and appendicitis in the patients, and absence of necrotic and presence of necrotic tonsillitis in scarlet fever. Did you understand, doctors? Okay, and the next, you know that in generalized form of yersiniosis, the patients may have bacterial foci in different internal organs, and they may have pyelonephritis, meningitis, pneumonia, septic form of generalized form of Yersiniosis as sepsis. And the patients with Yersiniosis, generalized form of Yersiniosis, may have hepatitis. And doctors, I want to say about the differences between acute viral hepatitis and Yersinia hepatitis. Hepatitis may be in the patients with Yersiniosis in generalized form of Yersiniosis. Differences. The patient with Yersiniosis may have hepatitis, and the patient may have jaundice, yes, and this hepatitis is connected with mesenchymal inflammation in the liver. But in acute viral hepatitis, cytolysis, you know about it. And the patients with acute viral hepatitis usually have high activity of ALT and AST. It may be 1,000 or several thousands, but the patients with Yersiniosis usually have moderate and large activity of ALT and AST. It may be 200, 300, but not more than 400. Yes? What else? The patients with acute viral hepatitis usually have in their blood count leukopenia and low ECR. The patients with generalized form of Yersiniosis, if they have hepatitis, they usually have leukocytosis, neutrophilia, increased ECR, and they usually have leukocytosis, generalized form of Yersiniosis, leukocytosis. What else? If the patient has jaundice, the patient with acute viral hepatitis, when jaundice appeared, the body temperature usually becomes normal. In the patients with Yersiniosis, if the patient has jaundice, the patient usually has jaundice and high fever. In Yersiniosis, what else? In Yersiniosis, if we begin our treatment using antibiotics, jaundice decreases very quickly. But in acute viral hepatitis, if the patient has jaundice, antibiotics play no role in this process. Yes, no, we can use antibiotics in severe course of acute viral hepatitis. Yes, but if the patient has moderate course of disease, acute viral hepatitis, antibiotics have no effect. Yes, but in Yersiniosis, if we begin to treat our patients using antibiotics, jaundice decreases very quickly. Okay. Generalized form. And doctors, the patients may have generalized form of Yersiniosis, septic-like form of Yersiniosis, yes, and these patients usually have high intoxication syndrome, high temperature, chills, sweating, enlarged liver and spleen, jaundice, rash on the skin, as sepsis, and a lot of foci in all internal organs, yes, abscess formation. In this, so microabscesses may be formed in these internal organs. The next, doctors, the next secondary focal forms of Yersiniosis. Now, you know that this secondary focal forms of Yersiniosis, many adults infected with Yersinia enterocolitica develop reactive arthritis within weeks after the onset of diarrhea. Reactive arthritis is probably an immunological phenomenon because organisms are not found in the joint fluid. Individuals affected most severely by arthritis often possess the major histocompatibility antigen HLA-B27, secondary focal forms. And erythemanodosum is associated with a number of infections, including Yersiniosis. Typically painful red subcutaneous nodules, 1 or 5 centimeters, sometimes as egg in diameter, erupt on the shins, but lesions may involve the arms and thigh. Ocular or retrosynovial syndrome. Yersinia are the causative pathogen in 18% of patients with enteric ocular or retrosynovial syndrome. What does it mean? Conjunctivitis, urethritis, and arthritis. Doctors, I want to say that in the secondary focal form of yersiniosis, the patient may have only conjunctivitis, or only arthritis, or only urethritis, but combination of conjunctivitis, arthritis, and urethritis may be rare. Okay. A relationship between Yersinia seropositivity and thyroiditis has been reported. A major feature of yersiniosis is the frequent occurrence of chronic sequelae. The most common are erythemanodosum, reactive arthritis, and Reiter's syndrome. Myocarditis, glomerulonephritis, and liver failure are unusual. We know that the patients with the secondary focal form of yersiniosis may have arthritis. It is the first, of course. Erythemanodosum, Reiter syndrome, myocarditis, thyroiditis, and enterocolitis. Doctors, the patients with yersiniosis may have the secondary focal form of disease. It may be Crohn-like disease. If at the moment of examination, if you examine the patient with Crohn disease, please ask this patient about his anamnesis. Maybe this patient had diarrhea syndrome maybe several weeks or months ago, and the patient, it is very difficult for the patient to remember about it, but we ask the patient about his anamnesis, and the patient may answer, "Oh, I had diarrhea, food poisoning disease 1 month ago, and I stayed at home. I used some rehydration drugs, rehydron and antiresorbents and spasmolytics, and after several days all the symptoms were stopped." Okay, and in this case, if you know about this anamnesis, it's necessary to check his blood, and you can use serological tests. If the patient had the first clinical signs 1 month ago, several weeks ago, this patient may have diagnostic titers of antibodies to Yersinia species. And I want to say that I examined 2 patients several years ago. I examined 2 patients. One patient had diagnosis Crohn disease, and the second patient had diagnosis non-specific ulcerative colitis. Now, we say not non-specific. We usually say ulcerative colitis. And I asked these patients about their anamnesis, and they said that they had diarrhea and abdominal pain and cephalograph temperature several weeks ago. We checked their blood. These patients had yersiniosis, but they didn't receive antibiotic treatment. Then they received antibiotic treatment, long-term antibiotic treatment. We usually use antibiotic therapy not less than during 2 weeks. And these patients had recovery. Doctors, don't think that each patient with Crohn's disease or ulcerative colitis has Yersiniosis. No, don't think about it. But if you examine the patient with this diagnosis, don't forget about Yersiniosis. Because if the patient has Crohn-like disease, it may be the secondary focal form, you can help this patient using antibiotics, using anti-allergic drugs. You can help this patient. Don't forget about it. Okay. And doctor, what else? Now you know about the secondary focal form of Yersiniosis. You know about erythema nodosum, yes, and I want to say that erythema nodosum may be in the patient with tuberculosis, with some streptococcal infectious diseases. Erythema nodosum may be in sarcoidosis, and erythema nodosum may be in the patients with neoplastic diseases. Don't forget about it. Yes, it is very important for differential diagnostic. And thyroiditis, autoimmune thyroiditis, usually Yersinia enterocolitica O3 serotype or serovariant O3 may be the reason of thyroiditis. Yes, and if you examine the patient with autoimmune thyroiditis, don't forget about Yersiniosis, because it may be connected with Yersiniosis. Yes, and what else? The patients, it's necessary to check the patient's blood using serological test. Yes, and you can use ultrasound examination of this gland, yes, and hormones of this gland. In some cases, in this secondary focal form of autoimmune thyroiditis, Yersinia thyroiditis, it's necessary to use hormones and immunosuppressors in some cases, yes. Okay. Myocarditis, Yersinia myocarditis may be rare, yes, and these patients usually have sacral temperature, common weakness, tachycardia, dyspnea, and discomfort in the region of their heart. And we can use, of course, ultrasound examination of the heart, yes, and we can use this myocarditis usually have benign cause in Yersiniosis, benign cause of myocarditis, and these patients have no cardiac insufficiency. But the duration of this myocarditis may be long, 2 or 3 months. And doctors, what else? Now several words about other manifestations of Yersiniosis. A variety of other gastrointestinal and extraintestinal complications of acute Yersiniosis have been described. Gastrointestinal complications. Just a moment, doctors. Gastrointestinal and non-gastrointestinal complications of acute Yersiniosis. Gastrointestinal complications, suburative appendicitis. Doctors, you know that the patients with yersiniosis usually have catarrhal appendicitis. But in some cases, the patients may have suburative appendicitis and gangrene of appendix, and it usually connected with the secondary bacterial flora. It may be. What else? The patients may have, just a moment, doctors. The patients may have intestinal perforation. If you remember, I said about ulcers near the lymphoid elements of intestine, yes, and the patients may have intestinal perforation. And as a sequel, peritonitis. What else? Toxic megacolon, necrotic small bowel, mesenteric vein thrombosis, cholangitis, diffuse ulcerative ileitis and colitis. And doctors, the patients, usually old patients, may have mesenteric vein thrombosis and necrotic small bowel. It may be if the patient stayed at home with yersiniosis, an old patient, yes? This patient stayed, for example, at home, and this patient had intoxication syndrome and diarrhea and maybe vomiting, and this patient lost a lot of water, yes? And it may lead to decreasing of plasma volume, yes, and blood concentration, and it may be the reason of clots formation, and it may be in the vessels of intestinal vessels. And these patients may have mesenteric vein thrombosis and necrotic small bowel. And don't forget that it's necessary to treat these patients early, and we can prevent these complications. And these complications, necrotic small bowel, mesenteric vein thrombosis, peritonitis, may be the reason of the death in these patients. Don't forget about it. And the next, doctors, the next group of complications, non-gastrointestinal complications of acute yersiniosis. Now, you know about microabscesses formation in many internal organs in yersiniosis, yes, and the patients may have hepatic abscess, splenic abscess, renal abscess, endocarditis, meningitis, osteomyelitis, and septic arthritis. Yes, complications begin several weeks after the onset of acute infection and last for 3 or 5 months. However, they can also persist and follow a relapsing pattern. Despite of severity of many of these complications, overall mortality from yersiniosis is low. And doctors, despite of severity of many of these complications, overall mortality from yersiniosis is low. A major feature of yersiniosis is outcome complications, yes? A major feature of yersiniosis is the frequent occurrence of chronic sequelae. The most common are erythema necrosum, reactive arthritis, and Reiter's syndrome. And complications typically begin several weeks after the onset of acute infection. You know about it. And complications appear to be more frequent in Northern Europeans, especially those who are HLA-B27 positive, than in other populations. Several studies have found evidence of Yersinia antigens in synovial fluid and in peripheral blood cells in persons with reactive arthritis. A relationship between Yersinia seropositivity and thyroiditis has been reported. You know about it. And doctors, what else? Several words about differential diagnostic. Gastrointestinal form of Yersiniosis. Yes, differential diagnostic with food poisoning diseases, salmonellosis, and shigellosis. Yes, you know about specific abdominal pain region. Yes, right low abdominal region. You know about rash, catarrhal syndrome, the presence of catarrhal syndrome, pharyngitis, rash, usually around the joints, hood symptom, socks symptom, glove symptom, specific strawberry tongue, arthralgia, yes. All these symptoms are absent in food poisoning diseases, salmonellosis, and acute shigellosis. Abdominal form of Yersiniosis, differential diagnosis with acute appendicitis of another etiology, yes, and if the patient has appendicitis, but this appendicitis is not connected with Yersinia species, this patient may have normal temperature, yes, normal temperature, and if the patient has gangrene appendicitis, purulent appendicitis, the patients usually have high temperature, yes, and intoxication syndrome, doctors, attention please. If the patient has appendicitis of another etiology, yes, these patients usually have pain, intoxication, and intoxication syndrome always appears after pain appearance, but not before pain in the right lower quadrant. In Yersiniosis, the patient has intoxication syndrome it may be during several days before pain appearance in the low right part of his abdomen. But in appendicitis of another etiology, intoxication syndrome usually appears after pain, abdominal pain appearance. Did you understand, doctors? Did you understand? Okay. And doctors, can you hear me? Doctors?
Yes.
Yes. Standardized form of Yersiniosis, differential diagnosis from influenza and other viral aerosol infectious diseases, respiratory infectious diseases, yes? And you know about differential diagnostic with scarlet fever, we discussed with you, yes? And it says differential diagnosis with typhoid, paratyphoid diseases, yes, because we know about long-term intoxication syndrome in typhoid, paratyphoid diseases, yes. What else? If the patient has jaundice, differential diagnosis with acute viral hepatitis, and we discussed with you, yes. And doctors, it's necessary for differential diagnosis with acute viral hepatitis. It's necessary to use biochemical analysis, yes, and specific serological markers of acute viral hepatitis. Yes, if the patient has acute viral hepatitis A or B or D hepatitis, C hepatitis, we always use specific serological markers. Okay. And doctors, the next differential diagnosis with leptospirosis, yes, with leptospirosis, but you don't know about the that now you can have your rest 10 minutes, and after 10 minutes, please connect again, and very short we'll discuss with you diagnostic lab test and the treatment of Yersiniosis, okay, doctors?
Okay. All right.
All right, 10 minutes for you. The standard for diagnosis. Stool is the preferred clinical specimen for patients with intestinal symptoms. Stools often remain culture positive for weeks after acute infection. Other specimens, just a moment, doctors, the students are connecting. Other specimens which should be considered for culture include blood, throat, wounds, and specimens obtained at surgery such as the appendix or lymph nodes. Depending upon symptoms, joint fluid, pleural fluid, and abscess material may also be appropriate to obtain. Polymerase chain reaction and immunofluorescence assay have been developed, and we use polymerase chain reaction for diagnostic of Yersiniosis. But doctors, blood culture, we know about bacterial nature, bacterial etiology of Yersiniosis. And you know that we always begin our investigation from bacteriological analysis. But I want to say, doctors, that it's necessary to use specific culture medias and specific temperature conditions for the growth of Yersinia species. And in clinic, we usually use serological or immunological tests of diagnostic. And you know that the patients with Yersiniosis usually stay in the hospital after hospitalization. Yes, they usually stay not less than 1 week. And you know that from the second week of disease, we can use serological test for confirming of clinical diagnosis. And serologic tests are widely used for the diagnosis. ELISA and immunoglobulin have been developed. These assays can be used to detect IgG, IgA, and IgM class antibodies. IgM positivity supports the diagnosis of acute Yersiniosis. And doctors, you know that immunoglobulins A are the secretory immunoglobulins, and increasing of IgA, and if the patient has increased IgA and IgM immunoglobulins, it usually says about acute Yersiniosis. Persons with chronic sequelae have been oscillating antibody titers depending upon the activity of their illness. With chronic disease, you know, at the moment of exacerbation, the patients may have increased antibody titers, yes, and at the moment of in a not period, they may have low antibody titers to Yersinia species. No? Don't forget about it. ELISA test, serological test, PCR, we can use for diagnostic of Yersiniosis. And doctors, I want to say that sometimes, you know, that Yersinia species Yersinia species have intracellular localization, yes? And for example, if you think about this diagnosis, Yersiniosis, yes, but the patient has, after 1 week after the onset of disease, the patient may have low titers of antibodies. Please repeat this assay. After 10 or 14 days, after 10 days or after 2 weeks, yes, and if you are sure in this diagnosis, yes, repeat this assay. And after 10 or 10 days or after 2 weeks, you can observe diagnostic titers of antibodies. But if the patient has fourfold increasing of antibody titers, you can also confirm the diagnosis. Yersinia infection therapy in adults. Enterocolitis. The primary approach to treatment of Yersinia gastroenteritis is fluid and electrolyte replacement. If the patient has enterocolitis, indications for antibiotic treatment: severe enterocolitis, abdominal forms of yersiniosis, Yersinia bacteremia, generalized form of yersiniosis, Yersinia bacteremia localized infection. What does it mean? Yersinia bacteremia localized infection. The presence of Yersinia foci in, it may be microabscesses in some internal organs, maybe in one internal organ, yes? Patients with severe chronic diseases and secondary focal forms in the acute stage. Doctors, secondary, if the patient has, for example, yersiniosis, gastrointestinal form, gastroenteritis without colitis. If colitis is absent, we don't use antibiotics. We can use only symptomatic treatment, rehydration treatment, and spasmolytics and antisorbents. If the patient has only gastroenteritis, it may be rare in yersiniosis, but maybe. And we don't use antibiotics. If the patient has enterocolitis or gastroenterocolitis, if colitis is present, we always use antibiotics. What else? In all abdominal forms, we use antibiotics. In all abdominal forms. Appendicitis, generalitis, mesodermitis, in all forms we use antibiotics. What else? Generalized form of yersiniosis. We always use antibiotics. Usually IV injection of antibiotics, IV injection, and we usually use combined antibiotic treatment. What does it mean? For example, we can use combination of antibiotics from different groups. It may be fluoroquinolones, for example, and cephalosporins. And we use only IV injection. Did you understand, doctors? Generalized form of yersiniosis. The next, secondary focal forms of yersiniosis. When do we usually use antibiotics? We usually use antibiotics in the secondary focal forms of yersiniosis if the patient has exacerbation. What does it mean? For example, the patient has erythema nodosum, and this patient has intoxication syndrome, fever, common weakness, headache, the presence of intoxication syndrome, not only painful elements on the skin, yes, but also intoxication syndrome. In this case, we use antibiotics. If the patient has erythema nodosum, but the patient has no intoxication syndrome. He has normal body temperature, normal appetite, without common weakness, without chills. The patient has only painful elements, yes? And if the patient has painful elements, erythema these patients usually have edematous extremities, usually edema of the legs, yes? And but without if the patient has no intoxication syndrome, we don't use antibiotics. Did you understand, doctors? And the next, doctors. I want to show you erythema nodosum. You can see erythema nodosum. The elements usually on the legs, but maybe on the arms, yes. The size may be as egg, yes, and red colored with cyanosis, yes. What else? Erythema nodosum. Erythema nodosum, the elements of erythema nodosum on the arms. Okay. And doctors, gloves symptom. You can see red colored, yes, red colored distal parts of the arms, rash and edematous. Gloves symptom. And the same picture may be on the legs as soft symptom. And doctors, I showed this discoloration of the skin, and doctors, a rash on the skin in yersiniosis maybe as maculopapular rash, maculopapular rash around the joints and on other sides of the body. Okay. And doctors, what kind of antibiotics do we usually use in yersiniosis? Enterocolitis and abdominal forms, we usually use ciprofloxacin or ofloxacin. Ofloxacin is also fluoroquinolone. Ciprofloxacin 500 milligrams 2 times daily. Ofloxacin 400 milligrams 2 times daily. Sometimes doxycycline may be more effective, yes, 100 milligrams daily. Gentamicin and trimethoprim sulfamethoxazole. And doctors, how long do we usually use antibiotics? Till 10th day of normal temperature. It is very important. Don't forget about it. Till 10th day of normal temperature. It is very important. If you use antibiotics, for example, not longer than 7 days, your patient may have a relapse in future. Don't forget about this common rule. In yersiniosis, and the clinical form doesn't matter in this case. It may be an abdominal form, it may be a gastrointestinal form, or it may be generalized form till 10th day of normal temperature. The next, just a moment, generalized form of yersiniosis, we usually use combination of antibiotics from different groups, ceftriaxone and ciprofloxacin. Ceftriaxone 2 grams daily IV injection, and ciprofloxacin 400 milligrams 2 times daily IV injection. And doctors, what else? Antibiotics, yes, but the patients with yersiniosis may have usually have intoxication syndrome, and we can use rehydration treatment and colloid solutions, yes, against intoxication syndrome. What else? We know about arthralgia, we know about painful elements in erythema anti-inflammatory, non-steroidal anti-inflammatory drugs. We can use non-steroidal anti-inflammatory drugs. What else? We know about the slow type of hypersensitivity. We know about granuloma formation in yersiniosis, yes? And in all clinical forms of yersiniosis, we usually use anti-allergic drugs. Anti-allergic drugs. And what else? Doctors, we know that the patients with yersiniosis may have dysbiosis, and you know that the reason of this dysbiosis may be Yersinia species and long-term antibiotic treatment. Yes, for example, the patient, his temperature stayed high during 10 days. We use antibiotics 10 days and plus 10 days after normalization of his temperature, somebody 20 days. Yes, it may be the reason of dysbiosis in this patient. And after antibiotic treatment, we usually use probiotics, bifidobacterium, enterol, lactobacterium, and we usually use probiotics not less than 2 weeks, but it will be best if we use these probiotics not less than 3 or 4 weeks. And doctors, what else I want to say? That if the patient, for example, if the patient has erythema nodosum, yes, and this patient has painful dense elements, and sometimes if anti-allergen drugs are ineffective, we can use short-term course of corticosteroids. No, it may be only during 5 days, not longer. But in some cases, we can use in erythema nodosum, for example, in some secondary focal forms, you know, in, for example, thyroiditis, yes, autoimmune thyroiditis, we can use hormones. We can use short-term course of hormones. Did you understand? Doctors?
Yes.
Okay.
Yes.
Doctors, now our lecture is over and you can have your rest for your lunch, 40 minutes, yes? And then we'll have our class. I will my group, and you can use the Zoom links of your teachers, other students. Okay, doctors?
Okay. All right.
Okay, Professor.
Okay.
Okay, thank you, boss.
40 minutes for you, doctors. 40 minutes.